Glucose, blue, enters the beta cells of the pancreas via the GLUT1 glucose transporter. As glucose concentration goes up inside the cell, ATP production, red, increases. These ATP molecules migrate to the potassium channels and cause them to close. This causes depolarization of the cell membrane, spreading yellow waves or rings, which cause the calcium channels to open. Calcium ions rush in and cause the myosin filaments to contract, moving the insulin storage vesicles closer to the membrane, where they coalesce and release the insulin to the outside of the cell. When we add glipizide, it binds to the potassium channels and blocks them further and enhances the chain of events so that more insulin is released. So for normal beta cell, there would be little insulin release, as the ATP levels are low and the potassium channels are open, allowing the cell to remain negative and polarized. This means the calcium channels are closed and the myosin filaments are stretched out, with little or no insulin getting close to the cell membrane. When we add the glipizide, it triggers depolarization and insulin release. At the tissue and system level, adding glipizide promotes the intestinal absorption of nutrients and the pancreatic secretion of insulin. This results in a cascade of metabolic events, including an increase in the hepatic synthesis and storage of glycogen, an increased uptake and storage of triglycerides in adipose tissue, and greater deposition of protein and glycogen in muscle.